What is a cesarean section? A cesarean section, also called a C-section, is a surgical procedure performed when a vaginal delivery is not possible or safe, or when the health of the mother or the baby is at risk. During this procedure, the baby is delivered through surgical incisions made in the abdomen and the uterus. What is the procedure for a cesarean section? At the start of the procedure, the anesthesia will be administered, and a screen or sterile drape will be used to protect the sterile environment of the incision site. Your abdomen will then be cleaned with an antiseptic, and you might have an oxygen mask placed over your mouth and nose to increase oxygen to the baby. The doctor will then make an incision through your skin and into the wall of the abdomen. The doctor might use either a vertical or transverse incision. A horizontal incision is also called a bikini incision, because it is placed beneath the belly button. Next, a 3 to 4 inch incision is then made in the wall of the uterus, and the doctor removes the baby through the incisions. The umbilical cord is then cut, the placenta is removed and the incisions are closed. How long does the cesarean section procedure take? The typical C-section takes about 45 minutes. After the baby is delivered, your healthcare provider will stitch up the uterus and close the incision in your abdomen. There are different types of emergency situations that can arise during a delivery. In some cases, the cesarean delivery will happen very quickly, with the baby being delivered in as little as 15 to 20 minutes. This is an emergency C-section. Afterwards, there will be additional time when the provider will stitch up the uterus and abdomen. What happens after the delivery? A cesarean section is a surgical procedure and may require a longer recovery than a vaginal delivery. However, women who have undergone a long, difficult labor and delivered vaginally may have a longer recovery than those undergoing a C-section. Depending on your condition, you will probably stay in the hospital from 2 to 3 days. Once the anesthesia wears off, you will begin to feel the pain from the incisions. You might also experience gas pains and have trouble taking deep breaths. You will also have a vaginal discharge after the surgery due to the shedding of the uterine lining. The discharge, called lochia, will be red at first and then gradually change to yellow. Be sure to call your healthcare provider if you experience heavy bleeding or a foul odor from the vaginal discharge.